So as I discussed in previous section, the results, that is functional outcomes as well as the survivalship of implants is equivalent if done properly with the conventional one and a robotic one. So there is no substantial difference. The disadvantage of robotic being the cost. It's very costly instrumentation, software, or other things, and it's available in very few centers around the world. And as I mentioned, the outcomes being the similar, so you should go with the manual one without any doubt. Thank you.